Georgia has hit a grim milestone now in the fight against COVID-19. More than 1 million cases have been reported in our state. As of today, the state has seen 1,872 cases of the virus since the pandemic began. More than 4,200 new cases were reported just today alone. 24 new people have died and at least 200 more people are in the hospital. And after months of hinting that Americans may need a booster shot down the road, a major turn of events, we expect the Biden administration to announce that the time for a third shot may be soon. Just days after authorizing a third shot for people with weakened immune systems, the CDC could recommend boosters for everyone. The Fox Medical Team's Beth Galvin has those details.
Nothing has been finalized, but it looks like a third dose of the COVID-19 vaccine will be recommended about 8 months out from the second dose. But there are questions about whether booster shots are really needed now.
If U.S. health officials recommend booster shots, healthcare workers, long-term care residents and staff and seniors would likely be first in line again. And talk of a third dose of the vaccine recommended 8 months out from the second dose comes as the Delta variant is ripping through much of the U.S. and researchers are studying just how quickly the protection provided by the vaccine could begin to wane. But Dr. Felipe Lobello, an epidemiologist with Kaiser Permanente, Georgia, says he wonders what's driving this recommendation for boosters now.
To go to a third booster or third dose without a clear, solid evidence that is needed to avoid severe disease seems to be a little bit premature when 40% of the country still hasn't been vaccinated.
The FDA would have to authorize a third dose of the vaccine and the CDC sign off on it. Dr. Lobello says there is data showing the longer a person's out from their second dose, the higher the likelihood of a breakthrough infection. But he says most breakthrough infections in fully vaccinated people are mild.
I would like to see more clear-cut data showing that there is evidence of increased risk of severe disease and exactly when. It's not just Delta circulating, but how long ago did you get your second dose?
Since he got his shot back in January, Dr. Lobello is fast approaching the 8-month mark. He feels confident he's protected, but he says he hasn't ruled out a booster.
If the CDC, the ACIP, the public health authorities in the country show us data and give us a firm recommendation that this is what's needed, not necessarily what Pfizer wants to do or what the White House wants to do, then of course I will follow that public health recommendation.
And the recommendation for booster shots will likely only include people who've received either the Pfizer-BioNTech vaccine or the Moderna vaccine. Those who got the Johnson & Johnson vaccine may have to wait for more data on a second dose of that. For your Fox Medical Team, I'm Beth Galvin.